So wintry morning. Morning pa ba? 11:43 in the morning. At nandito kami sa Stockport. Galing ako sa eye center. Nagpa-check tayo ng mata kasi hindi na tayo makakita.
Malabo na yung mata mo.
Malabo na yung mata ko. Yung right eye ko is mas malabo na.
Oh no!
Anyhow, we're here on the road at kwentuhan muna tayo, June. Kwentuhan muna natin yung mga subscribers natin kasi it's still January and we want to give them some inspiration.
Ano regarding sa work?
I think anything in general. So we'll just talk about being a healthcare assistant.
Yun yung carer, no?
Yes.
Sa Philippines.
Carer, in short. At we'll tackle 5 key points dito sa ating talakayan. Sa ating pagdadaldal tungkol dito sa healthcare assistant.
Yeah, ideas tungkol sa healthcare assistant.
So first thing is to give inspiration. Second is the bonding of a healthcare assistant, and then third would be roles and responsibility. What do they do? And fourth would be our experiences, sharing our knowledge so far about it, as we both work in the hospital. At saka 5 siguro mag-screenshot tayo ng mga yung mga job vacancies tungkol dito and how much they earn in a year as a healthcare assistant para magkaroon sila ng idea yung mga nandito na
gusto pumasok sa
sa hospital work. So healthcare assistant, bakit ba ito yung napili nating topic? Kasi si June is a healthcare assistant. Maybe at some point I'll share my humble beginnings on how I started here. Maybe it will give you some inspiration then to get into hospital work at maging prosperous din, June, di ba?
Ano yung prosperous?
Hindi naman tayo ganun kayaman.
Oo.
Kaya we just learn how to save money at saka skimp on other things and save money. That's how we do it. But anyway, being a healthcare assistant, ano ba yun? Ano bang role dito?
Anong healthcare assistant?
Ano bang healthcare assistant? Generally, they look after patients.
Frontline.
Frontline. And then, I feel like they're the unsung heroes dito sa hospital. Lahat has got a very important job. But for me as a nurse, they're very, very vital to me. Vital to the patients, especially sa akin in a ward setting and any hospital setting, kailangan ng nurse, ng healthcare assistant kasi sila yung unang contact halos ng mga pasyente. At June, alam mo ba, may mga banding ito.
Anong band? Siyempre naman. Hospital-based na trabaho, nursing, may banding.
May band. So, inalaban niya ng Union last year, a year and a half ago, no? A year and a half ago, I think. Parang 2 years na ba? Anyway, nagkaroon sila dyan ng incentive dahil dyan sa paglalaban ng Union. So, there's 2 kinds of healthcare assistant. One is a band 2 and one is a band 3. It's a crossover yung trabaho nila. But actually, yung band 3, they do yung mga clinical procedures. Yun ang pinaka-difference sila sa dalawang health at sa dalawang band na ito.
Minor ng clinical.
Minor clinical procedures. Yun ang pagkakaiba nilang dalawa. So they both help the patients, yung band 2 and band 3, they both help the patients with personal care, hygiene, ano ba, pagpapakain sa mga pasyente. They order food. There are different levels of food to be ordered sa hospital. Different levels of fluids to be ordered, to be...
Different fluids.
Yan.
Hindi mabibigay kagad. So, you have to clarify muna sa doctor at sa nurse.
Ayan ay depende sa recommendations ng speech and language therapist. They follow that. At they both do the moving and handling based on the recommendations by physiotherapists.
Assessment.
Oo, may mga assessments din yan. Personally, you guys do your own risk assessment as well bago kayong mag-handle ng mga pasyente. Maski may recommendation na. At patient's condition does change at any time. Ngayon, eto na yung difference. Sa inyo, as a band 3, you do blood collection, venipuncture. You do blood sugars. You collect bloods from pathology for transfusion. Ano pa ba? Bladder scanning.
Scanning.
Ano pa? Observations. Documentation. So yung band 2 is more focused on just delivering personal care at saka just really looking after the patient. Wala masyadong clinical skills. At ayan ang inop ng hospital kasi nga dahil pinaglaban ng union. Ngayon June, tatandaan mo, mga healthcare professionals din, they escort the patients sa mga appointments. Kagaya ng MR scan, CT scan, X-ray, they both do that.
Tsaka in and out ng hospital. Inter-hospital.
Yung mga inter-hospital naman, yung pinakaayaw ni June is escorting a patients outside of the hospital to another hospital para sa specialist na appointments.
Ako yung pasyente.
Si June ends up being a patient pag siya ay nasa ambulansya kasi may biyahilo. Pero
isang duty mo yun. Wala na talaga. Kailangan mag-escort ka.
But both healthcare do attend the huddle, the handover in the morning or even in the afternoon. They both have the briefing from their nurses. They might have 5 or 8 patients depending on the ward, depending on the unit. Ano pa ba? You guys do communicate with the wider multidisciplinary team. Kagaya ng doktor, consultant, ng physiotherapist, occupational therapist, speech and language, psychologist, iba-iba, Jujun, di ba?
Depende kung sino involved sa patient.
At saka pinaka-importante, they speak to the family members when they come to visit during visiting time. Pero they're a little bit limited.
Limited sa based din sa mga data, information. Hindi tayo pwede sabi ng mga information na hindi kailangan.
So usually they divert yung mga informations na a little bit sensitive to the nurses and to the doctors. So for me, they really are very, very helpful, very vital in a shift. Without them, parang ako a little bit crippled ako kasi I rely on them heavily. Especially minsan sa mga cardiac arrest at saka responding to emergencies, I rely on band 3, yung mga aking mga healthcare. Band 3, band 2, I rely on them depending on their clinical skills. Alam ko na somehow kung palagi ko silang katrabaho, sino marirelayan ko dyan if there's anything that happens.
Pero lang to healthcare assistant based sa hospital, iba yung sa nursing home.
Maybe we'll discuss that some point, June, kasi you had some experience. And maybe when I share my humble beginnings, baka magkaroon sila ng idea. Ngayon, our personal experiences and opinions about this. Being a healthcare assistant is not an easy job.
Tsaka mentally challenging. Talagang challenging talaga siya.
Mentally challenging, physically challenging. In fact, we know some Filipinos who didn't get to finish yung full contract nila, di ba?
Until retirement, no?
Or even to retirement kasi they had to switch jobs kasi nga
due to injury.
Due to injury. Pag hindi mo minsan na-follow yung moving and handling, at minsan naman sobrang lalaki talaga kasi ng pasyente, maski follow mo yung moving and handling guidelines. Sobrang lalaki ng mga pasyente wherein yung legs namin, pagsamahin na ni June, isang leg pa lang na isang ng pasyente. Hindi naman nila kasalanan yun.
Mga obese,
may mga
6 foot
obese,
tall.
6 foot tall. Sometimes mga 6 foot tall. Tatandaan mo, ibang Pilipina is only 4 foot 9, 5 foot at maliliit. Tapos bigla mong move and handle ang mga 6 footer, 6 foot 2, 5'9", tas malalaki pa, lalaki. Oh my God, masakit talaga sa likod.
Iba-ibang klase injury to. Shoulder, back. Pero pinaka-common yung back injury talaga.
Sabi nga ng physiotherapy sa akin dati, before you come out of bed, you do some cat stretches. It helps kasi tatandaan mo, you're gonna be relying on your back the whole of the shift. Kaya we always try to do some stretching. Yun naman, he does some extra workouts para sa kanyang trabaho.
Hindi lang pala physical, no? Mentally, you have to be really patient.
You have to be extremely patient and not to respond sa mga accusations minsan ng pasyente kasi nga confused at you just really have to aggression, kung ano-ano yung sinasabi. You just have to be extremely patient, be the better person kasi nga poorly mga pasyente at minsan naman very demanding ang pasyente, maski naman hindi confused, sobrang demanding kasi sobrang nga silang demanding at sobrang bored sa kanilang health. Sobrang pagka-demand.
Pinaka-common ng babae. Alagaan ng babae.
Si Jun sabi niya sa akin, pinakamahirap daw alagaan ng babae. Generally, ito ko tatanungin nyo yung mga healthcare professionals.
Sabihin nyo, yung mga healthcare professional dyan, sabihin nyo sa comment kung totoo. Babae ang pinakamahirap alagaan.
Mahilig palagi sa toilet.
Tsaka kung isang bigil, lahat tumihili.
Tsaka parang ano yan parang mga marites kasi lahat gustong pakinggan kung ano nangyayari sa pain.
Lalaki, madali, sobrang dali.
At iba pa nga ang Pilipino, Jun. At iba rin yung mga ibang lahi din na akusahan ng sexual advantages against the patient.
Totoo yun. Maraming kasong ganun, no?
Meron nga isang Pilipino, wala naman siya dun sa shift na yun. Siya yung tinuro at siya pa yung sinuspend.
Ano siya, no? Day off.
Day off siya nung shift na yun. Pero siya, kasi sa mga puti, minsan sabi nila, we all look alike. Yun palagi nila sinasabi, we all look alike. Maski hindi naman tayo magkakamukha.
Binis nila sa itsura, no?
Siya pa yung sinuspend almost 3 months, 6 months habang iniimbestigahan yung kaso. So every time na may mga ganong episodes, they suspend muna para at least wala ka doon at it will not be tainted yung investigation. Pero syempre na-worry ka nun, pati yung buong pamilya mo na-worry, but you're still being paid. Maybe we'll discuss on that at some point. Pero kailangan, you have to be extremely careful, masalo na kung lalaki kayo at saka kung mga 16 years old, 18 years old, you have to have an escort, masalo na kasama nyo babae. Kasi ang mga lalaking healthcare assistant dito, they get to be assigned sa mga women. So walang pili-pili ng pasyente o kaya
bata, matanda, no? You have to look after them.
Unless yung family mismo at saka yung pasyente mismo nagsabi na I don't want to be looked after by a male carer.
May personal preferences.
May personal preferences yung family or yung pasyente, so they follow that. But generally, kahit lalaki dito can look after a female patient. They do personal care. So pag sinabing personal care, talagang hubad-hubod.
At ewan ko.
Ewan ko na. Hirap na ako mag-Tagalog.
Hubad. There you go.
Hubad. Oh no!
Mali, hubad.
Ay, ayoko na. Tongue twister pala ito. But so that's about it at the moment siguro yung ating sharing about it. But it's a rewarding job.
Yung mga gusto mag-healthcare assistant, carer dito sa UK, ito yung aming opinion.
At saka June, let them know ibang mga kasama natin Pilipino dito sa ospital. Actually mga nurses sila dyan sa Pilipinas, but they opt out not to be a nurse in here. Hindi na sila
marami din, no?
Hindi na sila nag-nurse
halos pareho din ang nurse.
Maganda rin kasi ang bayad.
Maganda, tsaka yung benefits.
Benefits at saka less yung accountability and responsibility mo. Unlike as a nurse. At saka bank lang sila ng bank, extra ng extra sa NHSP. Lalaki na ng mga pera ng mga yon.
Mag-nurse ka pa ba? Hirap mag-nurse. So kung gusto niyo mag-carer, ayaw niyo na mag-nursing, mag-try na kayo dito.
Pero may kilala ko rin dati, tatanda may kasama natin. Nurse siya, pero ang part-time niya, healthcare siya. Kasi less yung responsibility niya pag day off niya. Sweldo pareho pa rin halos. Kaya ganun talaga, rewarding. Kasi pag nakita mo naman yung pasyente na gumagaling, talagang masasaya. Masasaya
ka. Huwag kayo hingi ng pera, ha? Minsan nagbibigay sila ng mga pera, mga pasyente.
Huwag niyong kunin at baka balikan kayo dyan. Hirap na.
Pera, holiday pa, binibigyan. So you have to be careful ng mga binibigay nila.
So June, let's just pop yung mga trabaho na vacancy sa iba-ibang hospital siguro, no?
Yan, nalagay lang natin dyan.
Para magkaroon kayo ng idea. Pop ka na naman.
Pop ka na lang.
Magkaroon sila ng idea kung magkano per annum. And see for yourself if it's something that you would want to take as a job in here.
Sa future, no?
So that's it. We've arrived now in Trafford kasi magre-return naman ako ng item.
Nakikita ba tayo dyan?
Hopefully makikita nyo pa rin kami. Kung hindi man, nasa dilim na lang kami dito. Kasi pinag-aaralan namin paano sabihin yung hubad.
Hubad.
Ayoko na. I give up. Alright, take care everyone. June.
Take care. Bye-bye.
Bye everyone. At salamat ulit. At hopefully itong tongue twister namin we'll get it right one of these days.
Sige.
Oo nga pala, yung mga comments nyo, it's been so interesting.
Oo naman.
And we'll be discussing some of it a little bit more in our next few vlogs.
Comment ng isa, no?
Oo, talagang we're excited to discuss about it. May nire-request siya about banding.
Sige. At maraming salamat sa panonood.
And leave your comments. It's always nice to read and hear from you.
Experiences nyo as a carer, lagyan nyo lang sa comment.
And anything that you want us to discuss, let us know.
Thank you.
Thank you.
Bye.
Bye.